Hello everybody and welcome back to my blog. And as you know, I had a 2-week break because of something going on to my daughter essentially, but in our lives. So why am I doing this week's vlog on infantile spasms? The answer is this: that's what the doctors suspected that my daughter had. And it was possibly 2 of the worst weeks of my life. I can honestly say that. I cried lots of tears. You can probably still see that. And it was a revelation to me because I found myself as a doctor and the parent of a child potentially with this, Googling, and it didn't make pretty reading. So I thought that now we've come to the end of our journey, and I'll tell you from the outset that actually the outcome was good, notwithstanding what we were told, that I would do this to explain what infantile spasms are, because it's a very rare condition and not very well known, and also to hold out hope for parents, either way, whether you get that diagnosis or not, as in our case. So let's start with what on earth is infantile spasms? Well, it's also known as West syndrome because that's the name of the doctor that described it first in 1841. And he was describing his son who was head bobbing, and those were his spasms. So it's essentially repeated spasms in a child in clusters. So often you get 10 to 20 spasms at any one time, several times a day. And they tend to get worse over time if not treated. So how do those spasms present? Well, basically, the spasms are a sudden, rapid, what we call tonic contraction of the trunk, i.e. the body, and the limbs, the arms and the legs, and then a gradual relaxation over 1/2 to 2 seconds. Sometimes there's a gentle head nod, all the way through to powerful body movements, and it can be all of those things or a combination of those things. So it can be very, very subtle and almost impossible to see. They come in clusters, as I've said, with a 5 to 30-second gap in between each spasm. They tend to happen when the baby or child wakes up or just before they're going to sleep. They can be flexor or extensor. Now by that I mean flexing, this is flexing, extensing is opening out a limb, or a combination of both. The flexor type are brief flexing of the neck, so that means the head going down, and a flexion of the trunk muscles so the body folds in, and it causes a brief jerk and the baby can look like they're hugging themselves. In extensor spasms, you get contractions of the extensor muscles in the limbs, and an abduction of those limbs. So as I've said, a stretching out of the arms or the legs, but it tends to be a stretching out of the arms and a flexion of the legs, so drawing the knees up, or stretching out of the legs, extending, and drawing the arms in. It can be mixed, and mixed is actually the most common type of an infantile spasm. So a flexion of the neck, but an extension of the arms, for example. So it's complicated, and let's not forget, babies make all sorts of weird and wonderful movements and jerky movements all of the time. So missing these is easy. Also, missing them if they are infantile spasms is devastating. So the diagnostic classification of infantile spasms is that the baby is having spasms, has something called hypsarrhythmia on an EEG, which are brain waves, and I'll discuss those later, and a general learning disability. But they don't have to have all of those things, they can just have 2 of them. So it's complex. So who gets it? What babies? Whose baby? Well, anyone's baby, essentially. But the peak onset is between 4 and 7 months, and as you know, my Alice is 6 months, and when we first saw these she was just over 5 months, so she was at the perfect age, and 90% of them always start under a year old. So what causes them? And there are 2 different causes, or not, and what I mean by that is They can be what we call symptomatic, and so that means symptomatic of an underlying pathology. So they've got something else going on already which is then causing the spasms. Or they can be what we call idiopathic or cryptogenic, and that means there's nothing that we can find underlying that's causing them. So any disorder that causes brain damage can lead to symptomatic infantile spasms. So for example, prenatal, before the baby's born, conditions such as hydrocephalus, which is water on the brain, microcephaly, which is a baby that for some reason has a very small head, Sturge-Weber syndrome, tuberous sclerosis. So lots of underlying conditions can lead to infantile spasms. Genetic syndromes such as Down syndrome or Aicardi syndrome. Perinatally, so things that happen around the time that baby's born. So hypoxia or lack of oxygen. Brain ischemia, so the brain is starved of oxygen. Meningitis, encephalitis, trauma to the head, an intracranial bleed, so a small stroke as it were, and sometimes premature babies often have small bleeds on the brain, and trauma can cause bleeds on the brain. Or postnatally, after the baby is born, there are things like pyroxidine deficiency, maple syrup urine disease, phenylketonuria, meningitis, degenerative diseases, and trauma. So as you can see, there are lots and lots of underlying conditions, and I've by no means listed them all. Those are just some of the more common that can lead to infantile spasms. And then, as I've said, there are the idiopathic or cryptogenic children, and about 30 to 40% of cases are in this category. So there is no underlying cause for these spasms. So we say that a child has idiopathic or cryptogenic infantile spasms if they have normal psychomotor development. So they're reaching their milestones, doing what they should do, smiling, sitting, moving their limbs in the right way, reaching for toys, for example. If they're developing normally leading up to the spasms, if there is no underlying disorder present that we've just discussed, and there are no neurological or neuroradiological abnormalities. So when we do a scan of the brain, there are no underlying abnormalities, and no, you can't find any neurological deficiencies or abnormalities when you examine the baby. So if the baby sits in that category with all of those things, then we call infantile spasms, when they're diagnosed in that baby, idiopathic or cryptogenic. There are some associated symptoms with infantile spasms. So 70 to 90% of babies with infantile spasms have psychomotor delay or even a reversal. So progress that they've made in their development starts to go backwards. So they might have been sitting and then suddenly they're not anymore. They might have had a pincer grip and then suddenly they're not, and so on. And there's quite often a mild to moderate growth restriction. So as I've said, this diagnosis is not a good one. You know, the long-term outcomes are not always good, and I will talk about prognosis. But for me as a mum, it was devastating, as you can imagine. And I'm going to do something I haven't done in any of these vlogs before. I'm going to try, if I can edit it, and put the clip of Alice having these spasms that led to doctors believing that this was a diagnosis, so that you can see, firstly, how difficult they are to spot, but then also how difficult they are to differentiate from lots of other things that babies do. And in the clip I'm going to put in, she has about 6 extensor spasms where she's throwing her arms out, but also tensing her chest and neck. And she does it repeatedly. And it actually went on for longer than the video, but I made a few videos that night. And it was that video that I'm going to put in here that we sent to the neurologist that we know, who came back and said, this is infantile spasms. Hey. Hey. Oh. So we then embarked on a series of tests, and that's how we get to diagnosis. How do we diagnose infantile spasms? Because surely you can't just do it from a video. So the first thing to do is an EEG. So that's where you have lots of little wires all over the head which trace the brain waves of the child. And initially we had an EEG for Alice for about an hour and a half, and in that time she was awake and she was asleep. And that's important to see what the brain is doing in those two different states. And in about 60 to 70% of children, they will have a typical EEG which shows something called hypsarrhythmia. And hypsarrhythmia is a chaotic, high to extremely high voltage, what we call polymorphic, that means lots of different shapes, delta and theta rhythms, with lots of superimposed, so over the top, multifocal wave changes. So basically it's a really chaotic brainwave activity EEG, and that's quite typical in 60 to 70% of children when they're diagnosed. You can see variations on that pattern. Now, in Alice's case, that first EEG was normal, and I was absolutely thrilled as a mum, as you can imagine, because I thought that was it, it's over, this is not the diagnosis. But unfortunately we had that conversation with the neurologist where she said, well no, we've seen the videos, we think it is infantile spasms, and in 30 to 40% of children you catch it so early that they've not yet developed the hypsarrhythmia on EEG. So we need to do a longer EEG where we see her doing the spasms and then look at the EEG. Only then can we say yes or no for sure. So we then went back into hospital a week later for a week continuous EEG. So the amazing little Alice, who takes everything in her stride, sat for nearly 2 days with the electrodes glued to her head and never complained, but did have spasms. And the technicians and the neurophysiologists and the neurologists were able to look at the EEG during those spasms, and I am thrilled to say that she did not have any associated EEG changes whilst she was having the spasms. So in this case, and any other case where this is the same, at that point the diagnosis is not infantile spasms, and I'll come on to therefore what it could be. So let's assume the opposite, that the EEG does show either hypsarrhythmia or changes during a spasm. So then the diagnosis is infantile spasms if it's pathognomic for infantile spasms. So then you're looking at lots and lots of other tests to try and find out if there's any underlying cause. So you would have an MRI to look for any structural brain abnormalities, a lumbar puncture to look at the spinal fluid to see if there was anything in there that would give a clue. Lots of different bloods, from calcium through to genetics, to just check whether or not there was an underlying issue there. Some urine to test for amino acids and organic acids, and looking in the blood for biotinidase. So those are the kind of tests that these children would then have to try and find what was causing this issue from an underlying point of view. As I said before, there may not be anything, they may be idiopathic or cryptogenic, but it's always important to find out if there's something else, because you might be able to treat that. So, having got to the point after 2 weeks of sheer hell of just worrying about what would happen to Alice should she have this diagnosis, and really understanding the pain that mums go through when faced with any long-term illness that their children might have, not just this one, anything, we finally got the all clear. But Alice was, and still is, doing these spasms. So, excuse me, the question is, what other things can cause these spasms that look like they might be infantile? Well, there are a few things, not many, but a few. So The Moro reflex is a natural reflex that all children, babies have, that they lose at about 4 months old. But up until that point, if they're shocked or move suddenly, they will throw their arms out and then back in. And that's called the Moro reflex. That can sometimes be confused with infantile spasms. There's something called spasmus nutans, and this is rapid, uncontrolled eye movements, head bobbing and abnormal head positioning, so a lot like infantile spasms. We don't know what causes it, babies do get it, and it usually resolves after a few months, so it's completely benign. There's something called bobble-headed doll syndrome, and that's a movement disorder, and it's episodic up and down or side to side movements, and that one isn't so benign. It's often associated with brain tumours, aqueductal stenosis in the brain, or a communicating hydrocephalus in the brain, amongst some other things, so that one's not so good. Other seizure types, so other forms of epilepsy, because infantile spasms are a form of epilepsy, but just a really devastating one. There are other forms of seizure types that it could be. And then there's something called Sandifers Syndrome, and this is what Alice has been diagnosed with. Now, Sandifers Syndrome is body stiffening that happens in some babies, and we don't really know why, due to reflux, and they are very similar to infantile spasms, and they are often confused. And you won't know this, but Alice's weakness is her gut. So she did have reflux as a baby, she did have cow's milk protein allergy. I did change her milk when I came back from the Christmas break, so instead of having completely amino acid milk, I introduced a hydrolysed formula that does have cow's milk in it, but hydrolysed. And who knows, maybe that aggravated her reflux, certainly gave her nappy rash, but maybe that aggravated her reflux. And she was on reflux medication, but I was being a little bit lax with it because it didn't really seem to be bothering her. So who knows, it could all be my fault. And obviously as mums we're really good at blaming ourselves, and I have examined myself to within an inch of my life as to what could have been causing infantile spasms and now Sandifers syndrome. So now I'm treating her reflux better and to the maximum dose of the medication that she's on, and we may even add another one. But the good news for us was that it was actually reflux. But obviously some parents don't get that news and they get a diagnosis of infantile spasms. So let's talk about that now. How is it managed? Well, the most important thing that it's recognised quickly and it's treated swiftly and quickly. So I guess my message today is don't just assume that it's reflux or something else or baby movements. If you're worried or if you're at all suspicious, nobody will say you're wasting their time to check it out, because the sooner you get this, the quicker you treat it and the better the outcome. You need to get immediate control of these seizures, and they are seizures. There are 3 drugs that are used: prednisolone, which is a steroid, vigabatrin and ACTH. But in the UK and Europe now we seem to have moved to a combination of prednisolone and vigabatrin. All drugs have side effects, obviously, but none of them are as bad as the damage that uncontrolled infantile spasms do, because whilst the spasms are ongoing, they damage brain tissue. So vigabatrin does have some issues later on with visual field defects for the eyes, but again, nothing as damaging as untreated infantile spasms. So what's the prognosis? Well, it depends on the underlying cause and whether or not there's any developmental delay at diagnosis. So there's a better outcome for these babies if there is no underlying identifiable cause. So if there's a normal neurological exam, normal development, they're slightly older when it's onset, not diagnosis, onset, and if there's a quick response to treatment. So the children who have idiopathic or cryptogenic infantile spasms have a slightly better outcome and can have completely normal development if it's caught early. Unfortunately, 70 to 90% of these children will have a fairly profound intellectual disability. 50% will develop cerebral palsy signs, and slightly less than 50% will show some autistic signs. 40 to 60% will develop Lennox-Gastaut syndrome, which is another epilepsy later on in childhood. So it's not a brilliant diagnosis, and you can see why I wasn't able to make a vlog during all of this. So I guess the question is, what's my message? Why am I making this vlog? As parents, we should always be on the alert for anything new or unusual that our little ones are doing that we're worried about. But even if we're not particularly worried, if it's new and they haven't been doing it before and it's repetitive, get it checked out. I'm going to put some video links to other children having different types of infantile spasms, just so that you can see how subtle it can be and how different the spasms can be. But get it checked out. Nobody will tell you that you're wasting their time, and if you get it checked out early and it is the worst, early treatment is essential. Don't Google too much. I did. I drove my other half mad because I was distraught by what I read when I Googled. And as a doctor, I didn't really know much about infantile spasms because I hadn't seen them. And I was distraught. The Googling almost destroyed me because it was all so depressing. Ask the doctors to tell you the list of things it might be, because they didn't for us. They just told us it was infantile spasms. They didn't say actually it could be reflux, it could be X and Y. So don't just let them tell you the worst. Ask for the whole range, because that would have helped me, because then I would have Googled different things if I Googled at all. When it comes to our little ones, we are so vulnerable, and I'd never felt more vulnerable at this time. So I'm sending out my love to anyone out there with a poorly little one. I belong to a Facebook group of doctors that's got 17,000 doctors, and they sent me so much support in private messages, sharing their stories. There were at least 3 mums who did have children with infantile spasms. So it's rare, but it's not that rare. And it really, really helped. So I'm hoping I can do that for you. And I'll put loads of links in and loads of videos afterwards so that you can have a look. And don't worry, just always seek medical advice sooner rather than later. And for those of you who want to know about my beloved Siamese cat, because at the same time he was looking fairly ill. He is still ill, but I was unable to take that awful decision at the time because there was too much going on. So I put him into hospital for 4 days, which cost me a month's salary. And I got them to rehydrate him. He has kidney failure. And actually, as we talk, he's in the hall now, eating, looking much better. And I think we might have bought him a little bit of extra time. So all in all, it was an awful 2 weeks, 4 weeks, but it was also a good one from the outcomes. And I thank you for your lovely kind wishes. And I hope this has been useful. And please do ask me any questions and suggest future topics. Thank you as ever for watching and supporting me.